I would now like to invite our panelists for this very interesting discussion. Please welcome on stage Sowmya Reddy, founder Paradigm Shift. Welcome, Sowmya. Mekhla Krishnamurthy, Senior Fellow, Center for Policy Research. Arshi Adil, Senior Manager, Digital Financial Services, Microsave Consulting. Welcome. I'll now hand it over to Mekhla to moderate the panel and get us started with the discussion.
Okay, it's a great pleasure to be here. So, and thank you very much to Intersection for inviting me and inviting us to this really interesting and important discussion. One challenge is this universal. Do we slip between basic income? Are we talking about basic income? Are we talking about universal basic income? One challenge. Secondly, and this is a big thing, then we have added the women. Now again, with women, we have many programs in India and around the world which center women. But there has always been in development policy a great instrumentality whenever women were brought into the picture. Because even in health and nutrition, it was, well-educated women nourish their children better. The instrumentality of why you should invest in women is often linked to their reproduction functions, linked, same in microfinance, women are better at repayment. It's linked to sense of responsibility. The other panel that we're looking at is on care. That function is often feminized. The care economy is also made into a women's economy. And then there is this question of empowerment, right? So the two words that usually go with basic income or universal basic income is poverty alleviation and women's empowerment. Two of the most multifactorial and complex policy challenges that we have, where we then try and solve these problems. And they aren't really problems to be solved. They are actually fundamental social relationships. The way poverty actually emerges, and they're also deeply dynamic, right? So they're not static at any given point. So this panel is about trying to contextualize this. What does it even mean to realize basic income for women? Then to learn from the extraordinary experiences that we've already had in experimenting. It has been an experience of a range of targeted schemes of different kinds, many of them centered on women. And so we have a lot of learning that we can do, and that's what I'm hoping to do with both the panelists, to learn from the experience and then to think about the Indian experience building on that. But the challenge in India is that UBI is actually supposed to be not targeted for everyone and about basic income, right? And what we've done in India is very different from that. So how do we learn from this and then think about the way forward? I want to, and one final point before we turn, to everybody, is, in India, one of the big policy challenges we have is trying to solve many problems with one solution. So I just mentioned poverty alleviation and empowerment. They are obviously interrelated, but they are incredibly complex in their own terms as well. I do a lot of work on agriculture and agricultural markets amongst my other work on the state, and the MSP is the same problem. If you ask people what problem does the MSP solve, one group will tell you it solves the problem of production. We need to produce more, so we give MSP. The other is that it is a problem of insurance, that farmers have a lot of volatility, it gives them assured price and insurance against price risk. A third is it is income support, that it supports income. Now, each of these for farmers is incredibly important and complex, but one single instrument struggles to solve it, right? And so in India, we keep doing this. We try and solve a very complex problem. And so I've come to think of it as we look for bang for buck, but we end up with short fuses, right? Because instead of solving the full problem in its complexity, we try to solve partially lots of problems and we burn out our fuse in the process. So I think we'll begin by asking the question of how to locate basic income, how to locate these different kinds of schemes and programs within the challenge that we have. And then we'll move on to learning from experiences, what has worked and what has not worked, and then hopefully arrive at a little bit of a conversation around how should India, and when I say India, I mean the different states, which are also incredibly diverse, think about this challenge going forward. So to join in this conversation, we have Sowmya Reddy, who is currently the General Secretary of the All India Mekhla Congress in Karnataka, and has also served as an MLA and has done a huge amount of work on, to her constituents and within the state, reaching basic safety nets and support. And then we have Arshi Adil, who is at Microsave Consulting and has spent, I think, 9 years or almost a decade, 8.5, working on research and understanding the design and implementation of a range of schemes. But we'll begin with a short video by Mahua Moitra, the MP from West Bengal, on the work that West Bengal is doing, but also her response to how to locate these schemes within the larger goals that we have in mind. So shall we begin with that?
West Bengal, now the only state in India that is governed by a woman chief minister, Srimati Mamata Banerjee. And when her government came to power in 2011, it was one of the topmost priorities of the government that the life cycle of the girl child, from the time she was born to becoming an adolescent, to becoming a young woman till death, is provided for. The basic idea is that women grow up with a sense of self-respect. They are empowered at a very early stage in life, that they have access to education, to health, and to all sorts of benefits that at the village level and at a rural level had traditionally been reserved for only men. So we start with when a mother is pregnant with a child, and the care that is given to the mother is complete. It is completely free. You have the Asha workers going and checking on a pregnant mother. The delivery is completely free when the child is born. After the child is born, the school education system, both primary and secondary and higher secondary in Bengal, is absolutely free for girls and boys. Girl children as well as the boys are provided with free school uniforms, free books, free schools, free bags, and in fact even the midday meal that they have at school, the plate, the glass and the bowl that they eat from is provided for by the government. Between the ages of 13 and 18, which is when the highest dropout rate for girls happens, we have a scheme which has been recognized worldwide, which is the Kanya Shri scheme. It gives an annual scholarship to every girl child between the age of 13 and 17 years, 11 months. And when upon reaching the age of 18, between 18 and 19, if the girl has finished school and is unmarried, so it's an incentive to finish your education rather than go and get married before the statutory age, you get a one-time grant of 25,000. After this, after attaining the right age, if the girl wants to go and get married, then she can enroll for the Rupasri scheme, which is another 25,000 rupees, which is given as financial assistance for the wedding. But you can only get access to that after you're 18 years old. From the age of 25 to the age of 59, we have now the, I would say, pioneering Lakshmi Bhandar scheme. Lakshmi is, of course, the goddess of wealth. She's the female goddess of wealth, and is considered very lucky for every household. So a woman is obviously the, I would say, the protector, the caregiver in the household, which is why it's named the Lakshmi Bhandar scheme. So actually these women together can get 4,000 rupees a month, which is a lot of much, 48,000 rupees a year, which for a rural household is a substantial amount of disposable income, and it is coming in cash to their account. Nobody else has access to it. That itself is very empowering. From the age of 59, after the age of 59, when you hit age 60, then women have access to the old age pension scheme. There is also a widow pension scheme in Bengal, which is very comprehensive. So if you lose your husband, you get a one-time grant, plus you get a monthly benefit. You have under the MSDP program, you have a housing scheme for women who have lost their husbands. They get priority in getting access to a house. So it is really the whole, I would say, exactly the life cycle of a woman of the female gender from birth to death that is covered with the welfare benefits of the West Bengal government. Lakshmi Bhandar is, as poverty alleviation scheme, I don't think it's meant to be a poverty alleviation scheme. Lakshmi Bhandar is an empowering scheme for rural women who traditionally have had no access to cash and have had to skimp on household expenses and save every month. So Lakshmi Bhandar traditionally means a treasure trove. So women would have an earthen pot or something like this, and whenever they had some extra money left over from household expenses, they would put that in that. And when an emergency came along, they would break that earthen pot and have access to that money. So Lakshmi Bhandar follows from that, which means every month you get something that you can put away. You can spend some of it, you can put it away. So at the end of the year, you have 12,000 rupees or 6,000 or 7,000, 8,000 rupees, which you can use in terms of an emergency. And you don't have to ask someone for it. No one is accountable. No one but the woman is accountable for it. So it's not so much a poverty alleviation scheme. I don't think 1,000 rupees a month in disposable income. Yes, it goes some way, but doesn't certainly go towards alleviating poverty. What is more important is it goes to empowering women, giving them a sense of financial independence, which is very important for self-esteem in rural areas. I think anyone who critiques a scheme like, Kanyashri, there's nothing to critique, obviously, but it's a scheme like Lakshmi Bhandar. Economists the world over have spoken about the need. We saw during Black Swan events like COVID, for example, what people needed most in hand was hard cash. And cash is what fuels the economy. So let's look at it very simply. If you're in a rural area and all the rural women in the world in that particular area have 1,000 rupees extra a month to spend, they are going and spending. Also, there is a village market. They go to the village market, and let's say they're spending 300 rupees every week at that village market. So they're consuming, yes. What's the other side of that consumption? It's production. What are they buying? So they are going and buying that many more bangles or bindis or local handicrafts or shoes for their children or clothes. Or so the entire demand for those goods in those village hearts, when you're suddenly got 10,000 women more with that much more spending power, is going up. So if you're looking at consumption, obviously that's one side of the equation. What's the other side of the equation? You're giving them disposable ready cash, which they are ready to go and pump up the local economy with. Any kind of cash hound out program which has been given at the bottom of the pyramid has only led to fueling the economy and helped it move up the bottom of move up the pyramid. So this, I think, critique has been long done away with, and we've seen the world over, everywhere in the developed world and in, say, Scandinavia, which really sets the standard for welfare economics, has seen that the idea was to put more cash in hand into the poorest of the poor.
All right, so we have a couple of disadvantages now because we don't have any soundtrack behind us. So everything we say will not sound quite so momentous. But perhaps that's a good thing, because maybe we can listen to our own thoughts and realize that actually it's not so seamless or tuneful or melodious what we're going to be talking about. It is about poverty, and it's a very hard, long, and difficult road to empowerment. So maybe it's good that we don't have a soundtrack, but let's pick up, I think, also, Ms. Moitra isn't here, so asking and debating the questions around the scheme design will be difficult. But I want to pick up the conceptual points from here, right? The first was Lakshmi Bhandar, she says, is not poverty alleviation, but empowerment, right? And this is important. My colleague Partho Mukhopadhyay at CPR often says, welfare systems are made of safety nets and springboards. Right? And when you think about it, we often confuse safety nets and springboards. Again, it's the problem of trying to solve multiple problems, right? So she goes on from saying it's not poverty alleviation, but then locates it centrally within production and consumption, that they consume better and it's consumption smoothening, but also it fuels the local economy and has multiplier effects. Right? So actually, Arshi, I thought I'd start with you because your research has looked at what the impact of some of these programs are, at least at the level of perception, but then also attempting to understand actually what kinds of material impacts that these schemes do have. And we'll begin there and then turn to Sowmya.
Sure. So I cannot agree more with what Mohua ma'am just said, that more than poverty alleviation, it's about empowering women and also strengthening their agency. So I'd like to quote about a recent research that Microsave did in India, where we assessed 7 DBT schemes largely focused on women, including the Matra Bandhu Yojana, the scholarship, the Awas Yojana, and many others. And what we found that 84% women acknowledged that this DBT has had a very powerful and a very positive impact in their daily household lives. Most women, 80% of them, acknowledged that their decision making in the household decisions, whether it is about deciding grocery or deciding where their children will go to, all of this becomes easy and they get more agency in financial decisions as well. So I think there, and not only from India, we also conducted a research in Bangladesh where we were looking at another program that gives a lot of attention to women, which is called Primary Education Stipends Program, which is basically transferring the amount for education of their children in the accounts of bank of women. There also we realized that close to 73% women acknowledge that this subsidy program has had a positive impact in their lives, not only their lives, but also at a household level. Their decision making, their autonomy of deciding what they want to buy, from including basic items, daily items, to insurance. I think that is the power that these programs have.
You know, when you think about, this is perception, right? This is what they feel, and there's, we can do qualitative research to understand what it means. But in terms of material impacts, a lot of the work on microfinance, for example, assumed it would help fuel income generation. And what it found was consumption smoothening up to quite a long level till the amount you're investing actually increases dramatically, right? And so in terms of the material changes, does your research point more to a consumption smoothening kind of approach where people are consuming, or, is it savings, income generation? What is really sort of, what are the material or outcomes that you're beginning to see?
Sure. It's a gradual impact at every level. So I was speaking more from their perception, but we've also had data points where women have said that once they started to get stipends or get the benefit directly into their accounts, there were more digital spillovers of it. Like they could access a mobile phone, which they did not have before. So from the Bangladesh example, as I was quoting, I remember close to 40% women, or even more than 40% women acknowledged that after getting stipends, they were the first in their households to buy a phone for themselves, which was not a consideration ever before. And not only in terms of buying, as I said, insurance, they've also started to save money. So there are digital spillovers as well. Close to 71% women acknowledge that after they start to receive money in their bank accounts, they also start to save. It is not only cash outs, they've also started to transfer money directly. Their agency is increasing and being strong, not only in terms of consuming, but also in terms of investing, also in terms of thinking about their families, and also centering themselves.
Okay, that's great. I'll make one little point here for us to think about. I think the digital spillover, for example, is the mobile phone.
Yeah.
Right? Or getting a payment in your bank account. But the saving is not a digital spillover.
Sure.
It's a cash spillover.
Yeah.
It's actually, so somewhere I think it's really important for us to be careful around digital improvements in goods and spillovers and what is still an overwhelmingly cash economy.
Yeah.
Right? And women use this cash and it can come to your bank account, but it is actually cash that you then use for most purchases and other elements. Like they may pay with a UPI, or they may actually most of the time still pay with cash. We are still in rural areas an overwhelmingly cash economy. So, Sowmya, I wanted to turn to you, but particularly on this question of cash and kind, right? Because I know during COVID, you spent a lot of time actually doing relief. And what was so interesting about the COVID moment is everybody asked for more cash transfers. That was not the approach that at least the central government took, the union government took. State governments had different approaches as well, but it was an overwhelmingly food and NREGA story, right? The PDS, much maligned and continuously maligned, kicked in and did tremendous work. NREGA, which is again a physical scheme in many, many ways, did extraordinary work as a safety net. And I know you were out there reaching these benefits to constituents. But the conversation is now so much shifted towards cash. And I know the state of Karnataka had this particular challenge right now with grain, of conversion of grain into cash because of various other calculations and challenges in terms of actually procuring and accessing the grain. So when you look at this, both in terms of your views on poverty versus empowerment and empowerment, but also cash and kind, what you have actually been experiencing and seeing when we think about cash and kind.
So first of all, I really want to congratulate Indus Action, and it's really nice listening to you, Mekhla, and Arshi as well. So I just want to go back to what you just shared about, that is especially a couple of years ago. The pandemic was, a phase of our life where we really had to reinvent ourselves. And that also, and like you rightly said, ours is still hugely a cash-based economy. And there are a lot of people who do blue-collar jobs, daily wage laborers. And so what we realized, and overnight, they were supposed to just stop working and not step out of their houses. And in fact, at that point of time, there was no, every month, in the PDS, they said the rice hasn't reached either. And that took about 2 weeks more. And so, yes, I mean, there were especially, relief work, be it, like you said, even for people and accessing, just basic stuff like even vegetables and food and nutrition was a huge challenge at that point of time. And so also another thing that many of us, including me as a legislator, we also realized was that, there are many schemes that the government was, reaching, was at least supposed to help people through. But unfortunately, what really also happens is there is corruption. And then also many people don't end up really accessing, these schemes. Either they fall through, it could be like, for example, they were like divided into various different subcastes. And then they were like, okay, for example, in my constituency, that subcaste wasn't there, so they just couldn't apply. Or they end up, just paying somebody to apply for it. And then, and you know how it is. So, in fact, it was, so one of the poll promises was also, in fact, the party in Karnataka right now, it's less than 3 months old. And one of the there were 5 major poll the guarantees. And one of them, yes, of course, like you rightly mentioned, is the Griha Lakshmi scheme, which is, 2,000 rupees to every female, one female household, one female in every household. And then Griha Jyoti scheme, which is 200 units free. And then another one that is taken off massively is also free access to women in buses. And of course, there's another one called as Yuvanidhi. And of course, which is 3,000 rupees for unemployed youth who have finished their degree. And for people who have done diploma, it's, I think, $1,500. And another one is, of course, Annabhagya scheme, like you spoke about, which is 10 kgs when the previous Congress government was there. So we had started 7 kgs rice, and then the previous government had brought it down to 5. And now, unfortunately, we're giving 5 because, long story short, because of politics between the center and the state government, because of FCI didn't agree to give rice, so we're actually giving cash. And so I just, so it's, I just want to actually talk about the numbers of, as of yesterday, the number of women who have registered for the Griha Lakshmi scheme, that's the $2,000, is massive. I was just talking to the Ministry of Women and Child, and as of yesterday, it's 1 crore, 2 lakh, 10,608, and the number of households or beneficiaries is about 1 crore, I think 30 lakh. And I was just looking at the statistics. There are almost about the number of women who have actually registered in rural areas is much more compared to the city. I think in Bangalore it was just about 52, and in other places it was like 70 plus. And that's huge, and that's massive. I also want to just talk about, I know it's not cash specifically, but the free bus scheme has had a huge, socio-economic impact, because mobility is not just mobility. It's access to food, to education, to healthcare. And for the first time, in fact, I was a part of a jury last year of various people, including government workers. And this is a panel called as Bus Prayanikara Vedike. And so women who work in the garment sector, the salary is about 10,000 rupees. And they ended up, and the bus pass was, I think, about 2,000 rupees. And they ended up walking about 5 to 10 kilometers every single day. And after this scheme really took off, I don't think the government nor most people really realize that the kind of impact that this is really going to have. We saw Paura Karmikas, who basically health workers, use buses for the first time from travel to one place to another. Earlier, they would just walk. Because I would rather spend that 1,500 or 2,000 rupees every single month than, bus. And it's also access to, freedom. I saw, a woman who didn't have footwear was sitting in a bus, and she was like traveling to a religious place for the first time. So I'll just stop for now.
No, thank you. Those were really terrific insights, and I think it's important, particularly in the Indian context, to ask the question about cash and kind, right? Because the assumption has always been that they are either or, that we have to shift. So in fact, the debate post the challenges that Karnataka faced in bringing around the grain to cash has been greeted with a lot of optimism by a bunch of people who said, by default, you are now having to do what we should have always done to transform the PDS, which is to move things to cash. And yet, whenever people have done research on the PDS, and a great number of, the Right to Food movement and others have done this research, have found that people prefer grain. Right? In the end, also remember during COVID, if you had given people a ton of cash, it's not clear that they would have got grain, because there were huge problems with the supply chain. It was actually cash would not have helped them on food security. It may well have helped on many other things where people definitely needed support. So not like road transport, right? Would you give a transportation allowance or actually free buses? And it's interesting because, or good public transportation, right? Solid, it doesn't have to be free even, but even well organized. And this Delhi is the city of the metro, and we've seen the story here in a particular way. What I think Mahua Moitra said at the end, which is she used Scandinavia. See, the point is there, all these other services are in fact publicly provided. Right? And people are not privately financing public goods. The challenge with the cash transfer story is, are we moving to a private payment and provision of public goods? Right? That actually, how does one find the right complement and balance between what should be publicly provided, not by cash, but whether you're talking about roads or transportation, through health and education, it's not the same, providing vouchers and providing schools, providing health centers, health systems, and providing, maternity benefits. Of course, you can have both, and most people need both. But the debate internationally is, especially in the developed world, is in countries where they have done public provision, and then they're looking at universal income. Whereas here we have failed repeatedly in public provision of public goods. And so there is a great privatization of public goods provision. And the debate is whether the move to DBTs and to a lot of cash actually accelerates that, if not complemented with an equally strong emphasis on improving public goods provision, public systems, and access. Right? So I think that's a really important debate. If either of you have thoughts on how to think, like as a government, right? As a new government coming in, the 5 guarantees are interesting because they are a mix of public goods provision, right? And about income and transfers. And we have focused so much on the DBT story and are struggling still deeply, because there is a fiscal challenge. There is the question of state and center. There is the question of enormously complex public systems. So how do you, think about this public versus public goods provision? And I think Arvind Subramanian has often written about this, which is this private payment for public goods, right? Versus a complementarity here between the two, and whether governments, state governments or union governments can have the imagination for it. Because, 75%, like over 50% of the agriculture, I don't know whether that's a good thing or indicates how little we believe in agriculture. Because if we believe 2,000 rupees 3 times a year will meet your agricultural productivity and marketing requirements, we are failing farmers. But 50% of the budget goes to that. So maybe a thought on, like, as you look at the vision for government and others, how to balance this question of larger welfare and where these entitlements fit in.
I want to look at it as an optimist right now because, and especially as female, I think it's not just about, because it's just started and it's going to, money is going to start being remitted probably in less than a week. I was just thinking about all the different kinds of women who were just walking to my office, in the past 5 years. It's just and many of them would not even actually be from my own constituency. And it's simple things like, there was a woman who would actually come to my office once every other month for just, she needed medicine. And there are, and things like, school fees, college fees. And I think basic things like just having some money is going to have a huge impact on really, women in the household. And for me, really, I think that's really going to be kind of how is a woman really, there are advantages of obviously giving it to women versus, men. And considering also we have actually gone, I would say, a decade backwards since COVID, because it's actually pushed many people towards poverty. And we were also talking about many schemes. I mean, for example, even the schemes that she was talking about is also, there back in my own state as well. Things like nutrition, for pregnant women, and even for children in schools. I think these are, and malnutrition is also massively increased. And I think it's really going to have a huge impact. Basically also because you're also going to have financial freedom. And having access to that is also about, the amount of respect that's also going to increase within the family as well, right?
No, I think this is a really important point, and I think we'll come back, to the public point. And my concern was, how can we use the empowerment, the dynamism, to demand better of our public systems, right? Will the women using free buses, and a lot of it is about narrative, will the women using free buses have the right to demand better buses? Or because the buses are free, people will say, now be happy with what you've got. You got free buses, right? You are able to access health. Can you ask for better public health systems? Or are you going to be told, this is the Revdi debate, right? The freebies debate. That if you frame them as freebies, they don't become the beginning of an engagement with better provision, service provision, both public and private. And in a country like India, where the vast majority are still very low income, and you're looking at a very small number, we have to pay attention to this dynamic. Like, how can you use it as and this is the entitlement discussion, I think, that Indus Action talks so much about, legislated and rights. How do you use it to ask for more rather than privatize and be satisfied with just what is given, right? And that's the debate that I have. And Arshi, I'm sure you'll have views on how to think about this
I very strongly believe that instead of terming these as benefits, or we should rather believe that these are the entitlements that a woman should ask for. I would like to quote a small example. 10 years back, I was a college student and I went to a railway station and I was trying to buy a platform ticket. There were two queues, of course, you would know, one for men and one for women. And because the queue was shorter and I could get my ticket faster than men. A man pointed out at me and he looked at me and said, there's no difference between a woman and a disabled. And I have still not been able to forget that statement that he made. So I very strongly believe that the messaging that comes out from government has to be very strong, because you can't be talking about a freebie that you're giving to a woman. It's her entitlement about the systemic inequalities that they have faced over years, not only personally, professionally, everywhere. And this continues even today. So I think that messaging that comes from government, positioning it as their entitlement and what is the objective, relating it to the developmental goals of the country, I think that is very important.
Actually, thanks a lot. I want to also follow up on something that Sowmya said, which I thought was very important, which was on how hard it is to access entitlements, even when they have been, announced, often promoted, very well known, and in your research sometimes they're not all that well known, but even when they're politically quite prominent, the everyday battle of actually accessing them. And you talked about the registration process and the numbers being extraordinary, but even that registration is never an entirely easy process. And the question to you on this is actually from your research on inclusion and exclusion, which again I know is extremely important. It's work that Indus Action and we've been doing together also in Andhra Pradesh, trying to understand how to think about inclusion and exclusion, because these are not innocent or easy. And actually one of the things about universal benefit or universal basic income, again, was that it was supposed to be for everybody without having to jump through too many hoops to prove who you are, right? And that the burden of proof was not on the citizen to say, here I am, this is who I am, but it was on the system to simply give it to everybody, right? And India has never been good at universal. We have always done targeted. And one way of thinking about this is that, whenever you do it, because there's a fiscal cost, there are inclusion errors and exclusion errors, right? Errors of inclusion, which is who got included, who should not have been included, the moneylender, the rich landlord, the man, the intermediary, etc. And errors of exclusion, which is who got excluded because the system was so hard, or they were invisible, or they were hard to find, or they could not, like the person who didn't exist or supposed to exist, who gets left out. And universal schemes are much more concerned with errors of exclusion. Who is excluded in a system of predominantly poor and vulnerable people? The Indian state has been obsessed with errors of inclusion. Who got in, who should not have got in, right? And so these schemes, while we've tried to make it easier and more digital and other things, are still quite obsessed, especially as they become more and more targeted to particular age groups, particular constituencies. You change from being an unmarried girl to a married woman. You change from being a married woman to a widow. All these changes keep happening. But we keep expecting you to keep showing up and telling us this is what has happened to you so that you can get something, right? But I think governments are trying through data, through these databases, through other things to address this problem. And I think there's also a fundamental problem as a politician. I think this is so important. It's a public trust problem. I mean, we do not trust people. And therefore, we make these loopholes harder and harder. So in the design work, the research that you've done, this errors of inclusion and exclusion and how states are actually addressing it, and whether having these multiplicity of schemes targeted to particular people makes this easier or harder. Your thoughts?
Sure. So, I think one of the reasons why India often has more inclusion errors and why they're always concerned around not mitigating those is largely the fiscal limitations. Because we are a huge country and we are not in Alaska where it's easy to roll out a UBI scheme. So the moment the word universal comes, we are very cautious if we'll be able to deliver to the promises, because that's not easy. Even the case for UBI for women, if you talk about all the women in India, and the moment you will start targeting or start thinking that who should not be included, you'll use certain databases. You will say a woman who has a government service or potentially a wife of somebody who has a government service, remove those who are filing ITRs, remove those who have access to this, access to that, whatever. So half of it, I mean, then it's not universal anymore. So that consideration becomes very important. In terms of how different states are doing it right now, most states, when it comes to, there are many issues. There are many issues at grounds. The way things seem are not, that's not actually the true picture. There are many who get excluded. There are many who get included for wrongful reasons, and the government is still trying to address these problems and how basically different state governments are trying to do it. I was in Bhubaneswar, Odisha, for Kalya, assessment of this basic support program for farmers, which is very similar to PM Kisan. And I realized that how state government was doing was to merge different databases and then running duplication to find out who are the people who actually deserve it. A few states like Rajasthan and Madhya Pradesh, they started making family databases to understand at what level and what frequency they are giving benefits, and then started to deduplicate. I was in Andhra Pradesh for some assignment, and I saw that the government made a very strong household level database, and then they started to reduce and exclude and include people based on that database without people knowing. Like someday you would just get a message on your phone that says you are excluded from the food security program, and the person would have no idea. And then delving deeper, we realized that they were looking at ITR. So those are some of the things that the state governments and the center government is trying to resort to.
Yeah, okay. So I wanted to, this is super, super interesting and also so important, because I think how we look at this and the actual social impacts and the political impacts of a state that keeps trying to verify, right? Like one of the things that I've seen happen is we have become a verification state. And I remember one of the state government, saying to me, we are generating a suspicions list. And I said, what are you doing? Why are you calling it a suspicion? Again, this is about public trust, right? If people are going to spend so much time verifying themselves and we are going to verify them and the state, if the primary state-citizen interaction is going to be a verification one in this process, we need to pause and ask what is happening in design, right? What kind of vision is this for inclusion or for entitlements? I think we have very few minutes left for questions, so I'm going to leave something here and then open up for questions. Is this question actually of entitlements and legislation? So I think Indus Action says legislated rights, right? But a lot of the things we talked about, including the 5 guarantees, are schemes, right? And you've been a legislator, so you know the importance, and there's been a lot of debate about, schemes that can't be delivered. I mean, right to food and employment were extraordinary. I know education is something that's an ongoing struggle, which Indus Action works so much on, that actually weakens, your rights as citizens, right? So if the state cannot deliver it and is not held accountable, then it's better not to be legislated and delivered as a scheme till you're ready to deliver it. The other view is if you don't legislate it, you will never deliver it. You cannot hold the state accountable. So there's a big debate on this, and I thought, in addition, we'll take some questions, but it would be great in conclusion just to have your thoughts as a legislator as well as a researcher on this question of entitlements being legislated versus schemes which we are proliferating, which aren't backed by law. So are there any questions that we, yes?
A couple of years ago, in fact, Chief Minister of State also had taken ration through PDS. That was very, very interesting and fascinating to me. So just wanted to understand from you, what do you think what is this social contact between citizen and state which allows something like this to happen, and why it cannot happen in other states?
It's a really interesting point. Every time I have spoken to frontline workers about what to do to improve their services, they've said, you make all the MLAs come and deliver in this hospital. You make all the MLAs send their kids to these schools. You make all of them take PDS and other things and use the same grain in their homes, and we will see improvement in the system, right? So this is another argument for universal. But we'll take one more question, or if there are more questions, and then I'll turn to both of you. Yes?
The continuous thread you spoke towards the last differentiation between scheme and the legislation. Is there any evidence, empirical evidence, that a scheme, if comes in the form of legislation, gets implemented better in terms of last mile delivery? Also, if there's any ethnographic study of how it lands with citizens, if it's a scheme vis-a-vis it's a legislated right.
Contract across states and across Indian society, and legislated entitlements versus those delivered in scheme. So maybe, Sowmya, do you want to take the social contract and legislation and your views, and then I'll come to you, Arshi, and then we can...
I'll just speak in general a little about what Arshi was talking about earlier as well. I think one of the biggest issues, or I don't know what we should call it, but in our country is population, right? And how do we really, for example, when I travel abroad, or when I basically come from an environmental engineer background, and we talk about a bunch of different things. I'm like, yeah, this is great, but it really doesn't apply back home, because again, the problem is with implementation. And I think this is also applies to many other things that we spoke about as well, as do we use this or that? So in the sense, one of the reasons also a lot of governments tend to kind of, bring out all of these things is also because of as either poll promises, right? And then one of the few things that is unfortunately not really basic, that is supposed to be basic in our country, is basic things like we were talking about education, healthcare, access to housing, and all of these things. And when we are really kind of, not able to kind of provide this to each and every citizen in the state or the country, and that's where we really kind of struggle to kind of to provide that. In the sense, like, it boils down to really find, okay, how much money do we have? Now, one of the biggest criticisms that the opposition is also telling in right now is, oh my God, there's going to be no development right now because of all these different schemes, right? So I think it's at the end of the day, I mean, how are we really going to make sure that there is all of these different things, roti, kapda, makan, is taken care of, and there is good quality of living, and at the same time, what really works, right? And it's also, like you rightly pointed out, I think the biggest issue in our country is also the last mile delivery. The last mile problem is because of various different things. It could be corruption, could be too much red tape. I mean, for one particular, scheme, I don't know, maybe I need to provide 10 different certificates, and also the, income tax certificate of this one and of the husband. And then like we also were talking about, many people end up getting left out of the system also because, I don't have one particular, domicile certificate, or it ends up also becoming, okay, it's just not worth it. Going again and again to the corporator or the MLA or, the local Bangalore one to just access this one scheme. So I think it's, a debate that, especially this is something that's new. I'm also quite interested. I think even in Tamil Nadu, that's also taken, I think, I keep forgetting, Magalir Hurumai, Togai, and also the various different schemes that Mahua was also talking about. I think especially focusing towards women is something that we really need to learn also from other countries as well.
I'm going to push you for 30 seconds on citizen-state contract, because as a political, both as a former legislator but also as a politician, this is one of the most difficult things, this question of what you think, what worries you and what gives you hope on the state-citizen contract in India today. Like just very quick last thoughts. And how they are getting forged in the context of these schemes.
See, at the end of the day, is the number of things that are really being accessed and that is being available to citizens, each and every one of them. And another huge issue is also trust, like we also spoke about, from the government as well. And also, like we also spoke about, the biggest issues is also the amount of corruption, really, how much ends up, being, eaten up when all of these things are really promised to people, right? So, yeah.
Thank you. Arshi, final thoughts on this legislative question, that do we have evidence that legislated entitlements reach more effectively or just the same as scheme-based? Or does it make a difference?
So I think, Anurag, definitely if government becomes more accountable when it's a case of a legislated right. Even if you look at PDS, it is backed by Food Security Act, and the PDS implementation across the country is one of the global best case studies globally. So that is something that I want to leave you with. But with regards to other schemes, I wouldn't say that the government is not accountable. But of course, when it is backed by a legislated act, I think the implementation becomes robust and the government is more answerable.
I'll take the privilege of the chair for the last point, because I think we often separate in India policy and scheme design from implementation capacity, right? And we don't think of the two together. We think about policy and implementation. And that is actually one of the reasons we fail to deliver both schemes and laws. So, one of the very good recommendations that were made to legislators was that actually every law should have, like you have a financial statement about how the law is to be achieved, you must have an administrative statement as to how are you going to implement this law. Right, because we don't do this. We don't think about law and implementation. We think law is something that can be contested, jurisprudence, litigation, all of those questions. But we don't think about its implementation. And we separate this out. So one thing that we often say when we think about state capacity is a law or a policy that cannot be implemented is a bad law or a bad policy. Whereas in India, we always love to say we have good policies and bad implementation. And we throw all the challenges on the frontline guys, the politicians, the bureaucrats. They are the problem. But sometimes I wonder, how did so much implementation happen with such badly designed laws? Actually incredibly poorly thought laws and policies, but somebody on the ground actually implemented them. So I think if we can think about policy and implementation together, about design and capacity together, the institutions that we need and the actual imagination that we need together, I think that may be the answer, and maybe that's the way ahead also for India, learning from all these experiences, both what we've done well, what the very, very long road still ahead in terms, but I think there's a lot of learning that we can have, and so I'll end there with this, and thank you to all of you, and many congratulations to Indus Action. Thank you very much.
Thank you so much, Sowmya, Mekhla, and Arshi, for this very, very insightful discussion. I think you really helped us all grasp, number one, the basics of basic income for women. That was really important for especially lay persons in the audience. Secondly, I think just building perspective on the constructs and means that would help enable a mission as such. That was very, very, I think that's great food for thought for all of us and very insightful. Thank you so much once again.